Welcome back, and if you're just tuning in, you're listening to Health Tech Talk, broadcasting from iHeartRadio Studios, 640 WGST, and also streaming worldwide on the iHeartRadio network. All right, Mark, we've had two great guests so far, but my next guest is, I think, totally in your sweet spot. I mean, it's about information, it's about data, it's about getting that information in the hands of physicians and also patients. How important is data in healthcare?
Well, I think it's, two things. First of all, data is completely useless unless you are able to do something with it. And I think that's the real trick. It's what you can get out of the data, as I say. How you do that, what insights you get. But I think everyone's really recognized that one of the last bastions of where data has to have a real role is in the healthcare space. There's so much of it lying around, and we've done very little with it. So I think there's masses of opportunities for us to leverage that into many, many different areas, drive efficiencies and new ideas and new tools.
Awesome. Perfect segue into me introducing Dean Stevens. He is the Chief Executive Officer of Healthline. All right, he has an incredible background. He's been part of payers. He's worked at Deloitte. I'm at Deloitte. And he's, a healthcare veteran. Spent his whole entire career somehow touching healthcare, and now he's running Healthline. Dean, welcome to the show, and how are you today on this Mother's Day weekend?
Yeah, Ben, thank you very much. I'm glad to be on your show, and also looking forward to celebrating Mother's Day with my wife and my mother.
That's awesome. All right, so first, give my audience an idea. What is Healthline? Why is it important, which is important, and also, how'd you end up there?
First, Healthline is a health information company, as you mentioned. We're in two businesses. We have the fastest growing health information site in the world, Healthline.com, for consumers that are seeking health information. We also have a software company, Healthline HIT, which develops software to understand the value that sits in unstructured text or data. And the two help each other, but they are two separate companies.
All right, so before we jump into it, we're really here to talk about, Healthline, not Healthline Corporation. But a question I got for you is, so is the company sort of, that portion of the company sort of like a WebMD? It's where my wife, my kids, family can actually get medical information, health information?
Yes, it's Healthline.com is now available to 30 million monthly visitors around the world. Many of them obviously come from the United States. Why we're growing so fast is really a function of the fact that we've figured out how to really engage people online and do it in such a way that we help them get activated about taking better care of themselves and or with their professional providers.
All right, so now that's awesome. So our audience should know. You can check it out, and you can look at and get some information there as well. But why is it so important that we get intelligent health information and solution to the healthcare professionals? And what's the driving force?
Well, the interesting is we've been looking at health information for the professional world grow leaps and bounds over the last 10, 15 years, particularly being now provided in a digital format. What we've discovered is that physicians have been put in a position where they need to quickly make diagnoses almost on the fly with their patients, and yet it's hard for them to access all the information that's available to them. A big gap in the market that we've seen is that few, if any, companies are able to extract insights out of the unstructured patient notes sitting now in these vast electronic medical record systems that are now deployed. Interestingly, this fact, I think, alone brings our attention to it, is the fact that 80 to 90% of all the health information being created for the professional community is in unstructured text and data sitting in these physician notes. So that's where the gold is, and we're trying to turn it into insights.
So how are you managing to do that?
The trick to this is being able to really understand medical knowledge, medical concepts, and the relationships between symptoms and drugs and treatments and specialists. And that's only half the game. The other half of the game is to understand the context in which this information resides in these systems. So we leverage the world's largest semantic taxonomy in healthcare, along with natural language processing techniques, to be able to read the medical language, but also the non-medical language.
So,
If you look, basically, people are being treated not on the context only of what they've been diagnosed with, but also in the context of who they are to make it a more personalized health intervention.
so that'll allow you to tell the difference between shingles on my roof and shingles the disease when people are talking about it?
Yeah, and that's a fairly easy task for us. Just understanding any word in the context of the healthcare industry.
That's great.
That's amazing. So let me ask you, so the customers for this, are they, I would think the usual suspects, are they the payers and the big pharma companies? Like, who is this information getting to after you accumulate it?
Well, over the past dozen years, Healthline has worked with the Fortune 20% of the Fortune 100 companies in America, from big pharma to the big payers to some of the big information technology companies like Microsoft and IBM Watson. And over the course of time, what we've discovered is that a lot of this information resided in what we called curated unstructured text, like textbooks and that stuff. But the great advance that's happened here just in the last few years is the accumulation of the uncurated, free-flowing physician talk that's translated into the electronic medical record. And so that's where the healthcare industry is now really turning its attention. And this is the payers and the providers in particular to try to unlock what's residing in this unstructured information.
That's great. I want to remind our audience we're talking to Dean Stevens. He is the Chief Executive Officer of Healthline. You can check it out at http://corp.healthline.com, or you can follow him on Twitter on Healthline Corp. Great organization. And I want to also make sure that we jump on one of your recent announcements is Coding Insights, right? It's a new coding optimization application in a suite of applications built on the company's health data engine. Can you explain what that is and why is this so exciting?
Yeah. Well, the world of healthcare is making a dramatic shift from paying doctors and hospitals on a fee-for-service basis to what we call the value-based reimbursement model, basically putting doctors and hospitals at risk for managing populations of patients, but also the individual patient. And it's through this shift to this new reimbursement model that we've developed this Coding Insight application, which basically understands patients based on their risk profile so that they can be coded for proper reimbursement. This gives doctors the opportunity now to see how their patients really line up with the risk model so that they can provide those patients the right resources. At the same time, get reimbursed by the payer, which is the federal government or the big payers that we know in the country, the proper amount to fund those resources to these patients.
Great. What else is coming down the line for Healthline?
Well, interestingly, the doctors that we work with in the marketplace see this as a great way to see what's going on with their patients. It's a synthesis of their history, their patient history, but it also gives them ideas around what they might be missing and how they should treat that patient. They're asking us now to look at gaps in care for their patient population so that they can identify those at most risk to be readmitted to hospitals, those most at risk at further decline in their health profile. We're trying to get them quickly informed about who those patients are and why they should be accessing them with additional resources.
And is this done on a practice-by-practice basis? Is it done? Somebody has to come down in person. How do you actually set about finding those insights for them?
The way that our application reaches the marketplace is through our direct relationships with players in the marketplace. Healthline works with medical groups. We also work with integrated delivery networks, and we work with the accountable care organizations that have sprung up in the last few years all over the country. But we also work with electronic health record companies themselves. What they're wanting to do is bake our Coding Insight application directly into their electronic health record system so that it's uniform and seamless to their system with the doctor.
That is incredible. I need to take a break. Dean and Healthline, thank you so much. I wish nothing but success for the organization. Data is the key, I think, and solving it is amazing. All right, I need to take a word from our sponsors. We'll be back after these words.